Hello, everyone, and welcome to the American Public Health Association Student Day event. My name is Vanessa Egby, and I'm the current National Public Health Week Fellow here at the American Public Health Association. Today's panel event is a collaboration with Howard University students, and the panel will include early and mid-career professionals sharing how they navigate postgraduate life and how they found their career in public health. And I hope you all are excited for this discussion. I would now like to give the floor to our moderator, Christopher Norman Howard, who is a current professor at Howard University and has an extensive career in public health.
Thank you, and good afternoon to everyone. The first thing that I want to do today is introduce you to our panelists of guests today that are going to talk to you about their exciting and rewarding careers. So the first panelist that I want to introduce you to today is Christian Bacon. Christian is a graduate of Howard University and serves as a community health educator with the Prince George's County Health Department. She holds a Bachelor of Science in Community Health Education. Christian is a wellness educator who is committed to uplifting and inspiring underserved communities, specifically Black and Brown women in the Washington, D.C. area. She formerly worked with the Howard University Student Association as the Nutrition and Fitness Coordinator. Christian worked for the United States Department of Interior's Office of Public Health for 3 years as a public health associate, creating programs that expose youth in the District of Columbia to national parks as an outlet for them. She has worked as a program recruiter at Promoting Practical Health Incorporated and served as the lead health educator for the Friends of Kenilworth, a not-for-profit organization dedicated to engaging children and families with the beauty of nature. Our second panelist today is Ms. Erin Buchanan, who currently works at the National Quality Forum as a manager in quality measurement. Prior to this, she worked at the American Academy of Otolaryngology, head and neck surgery as a senior manager of quality and performance measurement. She obtained the Master of Public Health and Health Policy from the George Washington University in 2014 and her Bachelor of Science in Health Science with a concentration in community health in 2012 from Towson University. Erin has always had a passion for health and has pursued that not only in her career, but in her free time as well. Erin is the current president of the Metropolitan Washington Public Health Association, the DC affiliate of APHA. And our last panel participant is Ms. Ayana Tucker. She is a communications specialist covering basic science research on the public relations, media relations, and corporate communications team at Johns Hopkins Medicine. Prior to joining the Basic Sciences Communications team, Ayana was the summer 2018 communications intern at APHA. In spring 2019, she completed her master's internship at the Center for Program Integrity at the Centers for Medicare and Medicaid Services, where she assisted with digital projects and writing promotional materials. Ayana received a Bachelor of Science in Nutritional Sciences from Howard University in May 2017 and a Master of Public Health from the University of Maryland in May 2019. I want to thank everyone again for coming out to this wonderful panel discussion sponsored by the American Public Health Association for National Public Health Week Student Day. And without further ado, I'm simply going to get into our questions with our panelist guests. And then towards the end of our segment together, I will definitely open up the floor for questions from our audience today. So the first question that I want to discuss with our panelists is, tell me a little bit about your background and what brought you to public health, and how did you get your current job?
So I guess I can start that one off. When I got to Howard University in 2014, I entered as a chemistry major. And around that time, I was doing a lot of personal research about health disparities, specifically the ones in my own family, actually. So as I was navigating that space, I came across a lot of people who were already in the community health education program at Howard University, and that kind of catapulted me in that direction. I ended up changing my major to community health. And around that same time, I was networking and met someone who was a part of an organization that connected HBCU students with public health organizations in the Washington, D.C. area. And that ended me up at the National Park Service, where I worked as a public health associate for 3 years. So it was kind of a lot of different ups and downs in my public health introduction. But I think that mainly going from chemistry to public health is what led me in the direction of really staying in public health and finding my niche in that way. And in terms of my current job, the job that I had in that arena originally, like I said, it was a result of just networking and really being around people who were passionate in my field and who had been in my field for a longer period of time.
Great, thank you. And what about Erin?
Hey, so I originally entered undergrad as a pre-nursing major, and I didn't get into the program at first. And I happened to be a community health minor, so I just made that my major since I was already interested in it. I'd already taken a lot of the courses, and I could graduate on time. And I found out that I liked that a lot better than the pre-nursing classes I was taking. And I graduated, I decided I would move on and get more education in public health because I volunteered at a health department one summer, and I learned that public health is a lot broader than just what's happening right in the community. And then in terms of my current job, I'm actually in an interesting place to be giving this presentation today because the job listed in my bio, I just got it, and I start on Monday. Monday is my first day.
Congratulations.
So I just applied for it. But that being said, I have the experiences prior to this, which set me up for this next step. And that's sort of the direction I'm going. So every job builds off of the last one.
Yeah. And what about Ayana?
Yeah, so, I kind of had a long journey to public health, and, it's actually kind of a long story how I ended up in my current position too, but I'll try and keep it brief. So I actually have like a really similar story to Erin, where I started out as a physician assistant major at Howard. And after 2 years, I went to the summer medical and dental education program, which is now the summer health professional education program, because at the time I really was interested in being a doctor. I really wanted to be a doctor, so I wanted to be a PA first, get acquainted with medicine, and then be a doctor. But at SMDP, I learned about public health. I had a small understanding of public health, but by no means did I have, the understanding that I do now. And SMDP really opened up my world. And at that moment, I was like, okay, no matter what I do, whether I become a doctor or not, I absolutely have to get my master's in public health. So I ended up graduating in nutrition, and I went straight to grad school. And before I even went to grad school, I also knew that kind of, on the side, I wanted to do some kind of communications, whether it be a TV show or something, a platform where I could talk about health, because you never really see people that look like us talking about health, right? And so then I was in grad school and took a health communications class. And I was like, oh, this is like a whole field and not just something that I have to do on the side. Like, this can be my actual career. So from that point on, I really made it a point to do communications as much as I possibly could. I applied for every communications summer internship I could find, and I was lucky enough to get hired at APHA, and I loved every second of it. APHA was the best time, and my portfolio exploded. And so, I was really excited about finding my career, but I was in a really rough position because I only had about a semester until it was time for me to apply for jobs, but I only had 12 weeks of experience. And we know that even though my portfolio was really strong, a lot of jobs are looking for that arbitrary 2 to 4 years of experience. And I didn't have that. That's just not possible for someone like me who went straight to grad school. So, starting in my third semester of grad school, I really tried to do everything that I could to get communications experience wherever I could find it. I had a graduate assistantship, and I started a newsletter at that graduate assistantship, and made sure my master's research was on Twitter. I even did my master's internship, in communications. And I think that really helped me stand out. But I even looked for more ways to make myself marketable, right? So I made myself a website. I made myself hard copies of my portfolio. And, being able to present that really made me super marketable. I've been offered to apply for positions just based on my website and just based on that hard copy of my portfolio. I really tried to get creative with how I approached my situation because I knew that lack of time experience was going to be something that I had to overcome.
Same.
When it comes to my actual job now, I actually got this job through just a personal connection, just a totally casual person that I just met at the time who's a friend now, and he happened to be working for Hopkins, and he mentioned that Hopkins, invest in young talent, that I should look into applying there. And I was like, okay, it's Hopkins. They're never going to hire me because it's Hopkins, right? But I looked, and they were hiring for a communications specialist. And so I applied, and the rest was history. And I know that, in being in my job now, I know that my managers were really kind of impressed with the way I was able to present myself through things like my website and the work I was able to demonstrate that I did.
Yeah. So what advice would you all have for someone who is getting ready to be a soon-to-be graduate from college, or maybe they recently entered the workforce? Across the world, we're dealing with this global pandemic of COVID-19, but there's still a need for people to be employed in this field. So what advice do you have for individuals out there who are currently looking for employment?
I'd say,
I think that for me as a communications professional, if anyone is interested in kind of providing information to the public about COVID-19 and really jumping into the workforce from that perspective, because let's be honest, the entire public health workforce right now is pretty much dedicated to coronavirus. I think looking for, freelance work is really important. And it's also a great way to just build your portfolio and build connections with people. I know a lot of people who have full-time communications jobs who also freelance on the side. And also I think cold calling people. As a communications specialist, my information is public. And so we often do get students just emailing us and wanting to know more about how we got into this field. And I'm not shy about responding to those emails. I know my teammates aren't either. So in this world, especially when we're all, in the house, socially distanced from each other, we can't go to networking events and things like that. If you see a position that you want to be hired for, you see an organization that you might want to work for, I think reaching out to them is a great idea.
I think that's a really good answer. I'd also say check with local organizations, especially those who work one-on-one with people in vulnerable positions, like homeless shelters, people in that situation, because they're probably in the greatest need right now. They're working with vulnerable populations who are at greater risk. So check with them to see if they have any openings, also local health departments, because the need for public health professionals is huge right now.
Yeah, I definitely agree with both those points. I think checking with your local health department is super important. And I think just on a more general level, it's super important to just apply. I think that oftentimes we get caught up in the logistics of what it looks like to apply for a job and like life after college. And there's so much emphasis being put on that we forget to just apply. So I'd say if you see something that's interesting, something that you think fit your background, to really just go for it.
Great. So let me ask the panel now, what aspects or skills from your educational background have been most useful in your professional careers? Are there skills you expected to be most useful in your fields right now? And then I would also add to that, sometimes questions arise from people early in their career, in the field of public health. Is there even an opportunity for someone who hasn't yet earned a graduate degree, like a master's of public health yet? Is there a place for you in the public health world if you've only earned a bachelor's degree?
Yeah, I definitely think that there's a place in the public health world if you don't have a master's degree yet. I think specifically in the health education field, I worked as I taught nutrition actually for quite some time while I was in undergrad and then transitioning into grad school. And so that's something that I just did with my nutrition bachelor's degree. But I think that, some of the skills that I took with me into the workplace from grad school are really just kind of the hard skills that come along with, being a behavioral community health student, right? So I think to answer this question, I kind of have to give some context as to what I actually studied in school. My concentration was behavioral community health. So essentially I was trained to, plan, implement, and evaluate public health interventions with the goal usually of some behavior change rooted in behavior change theories. Obviously, I'm not a program planner or evaluator or anything like that, but there are so many skills that go into that can be applicable to really any job, especially with coronavirus pandemic. So I've been working on this pandemic since about January. And one of my main roles is just kind of helping to develop the language that we're using and the science that we're using around the hospital and community to keep our patients and community safe. And so there are tons of, assessment and evaluation and just general project management skills that go along with doing that. But also when you're building a, intervention, you essentially have to understand how to connect with the community and how to communicate with the community. And that's something that I do daily at my job. But I think the one thing that really surprised me about, entering the workforce was the fact that overall, grad school gave me a context through which to talk about health. And for someone like me, that's imperative. A normal day at my job when we're not in the middle of a pandemic looks like a researcher or a doctor, sending us a manuscript or saying they have XYZ research coming out in a journal in so many weeks. And it's up to us to give that to the public, right? And so it's great if someone can get this manuscript, read it, write about it, and send it out. But it is a completely different story if someone can get that manuscript, read it, synthesize it, analyze it, and really think about, who that information is for, why that information is most important to that population, and what is needed to actually reach that population. And so we're shaping the stories that journalists and other media are telling the public. And we know that, journalism and media is, a huge asset, especially from an advocacy standpoint in public health. And that context, that frame of mind, that perspective is really only something that comes with just, really studying public health really deeply for a period of time. And it's something that I didn't really think about when I was in school. But in going into my job, I was like, oh yeah, I'm like really applying this in my everyday work.
And what about you, Erin?
So I studied health policy in grad school, and my answer is actually really similar to Ayana's. I've taken everything I've learned about health policy and I use it at my previous job, even though I'm not strictly health policy. So I work in quality measurement, and it involves measuring a physician's care in order to see if they're giving the best care in order for them to get reimbursed by the government, particularly in Medicare. So developing those measures is not technically health policy, but the guidance comes from the government. And my team really relied on me, because I had that background in health policy, to distill that guidance from the government into the information that would be useful for us and to determine what it means for us. So it's a lot of like synthesizing information. It sounds like we have similar experiences and being able to present that to stakeholders. I think that's a skill that anyone in public health can use, pretty much anyone in any field. Right. And really, when I went to grad school, a lot of our exercises were around writing memos, and the basic skill is synthesizing information. But I thought that I would be sitting in an office getting documents and then writing memos for everything, but that's not exactly how it is in real life in a public health situation. There's no standard memo that your employer might be looking for, but they will want that information so that they can read it in a bite-sized way.
And Christian.
Yeah, I think my perspective or my experience is a little bit different. I graduated from Howard May of 2019, and so I'm taking a little bit of a break from school between now and my NPH. I think that for me, though, in terms of skills that were developed in my undergrad career, in terms of being someone that's in health education, one of the biggest skills for me is being personable and being able to be someone that's genuinely interacting with the community that I want to serve. So right now, in terms of just the community health educator position I have with the Prince George's County Health Department, it really requires a lot of one-on-one interaction with the community. And so I think that in undergrad, being required to take hundreds of hours of fieldwork courses and classes kind of prepared me for the role I'm in now, which just requires me to really gauge the needs of my community by being in my community. So I think that that's one of the skills that I didn't really anticipate gaining while at Howard studying public health, but I think that's been really transformative in terms of making me a better community health educator.
Right. So let me ask you all one more question, and then we will start to take some of the questions from our audience out there today in internet land. But let me direct this question to Aaron first. You know, how important has it been for you to make professional connections with people in the field, and how were you able to do it? I would even add, you know, even during this specific time period, dealing with COVID-19, you know, what are some of the ways that you can suggest for people to network and connect with each other in the field?
Sure. So I will say, like, don't discount any person you've met in the public health field, outside of the public health field, because you never know when that will be your connection to someone else. So to give an example, my first job out of grad school was with the organization that I had done a culinary experience with in order to graduate. I wasn't expecting anything. I'd worked with them, I'd wrote a paper, and I helped them work with their program, which was a community health program. And I got out of grad school and I was continually applying for jobs. And nothing was really coming to fruition. And then they reached out to me and asked me to come in and help them. And they hired me. So that was one connection that I had. Now, in terms of like this weird time we're living in, I'd say that just to reach out to people. I got an email from a student that my mom knows who's in public health last week asking me if I knew any internships or knew any jobs in the area. And I could connect her with a few people because of that. So reach out to people you know or who may know someone who knows in the public health field or outside of it, because you never know who other people know and you never know who they know. So it's always helpful to just try, like, you never know. and also reach out to your professors and just have conversations with people. Don't expect like something to come from it right away. And I think that in this crazy time, it's important to like continually reach out, because people might not remember right away. Things are going on in their lives and in the world. So just pinging them occasionally and asking them what they might know would be helpful.
Okay, great. And what about you, Christian?
I agree with all those points. I think those are super important. I think for me, one of the biggest things was getting over that initial fear of reaching out to people, and not really being afraid, as we call it, shooting your shot, professionally, that is, in terms of people who might have access. And my father actually taught me the skill of following up with people. So if you were to network and go to an event and meet someone that has, you know, some resources or information that you need, it's okay to send them a Christmas card and say, hey, thanks for thinking about me. Really appreciate you for getting me connected to this person or this opportunity, but making sure you're being genuine in those connections, and really making sure you're following up as much as you can. I'm not afraid now if I'm watching a documentary and I see someone that's in public health to Google them and check out their LinkedIn and send them an email, and you never know what can happen. But it's just about casting a large net. And then after you get that connection or that resource, making sure that person knows you're appreciative, because you never know what can grow or happen post that and what that can become later on professionally. So I think that's super important.
Yeah. And any comments from you, Ayana?
Yeah, I think that, following up, like Christian said, is super important, even when you maybe don't take the opportunity that you were talking about or anything like that. And I also do want to, again, stress that even casual relationships can really go really far. Keeping your ear to the ground, which is essentially what I did, is how I got hired. But I think that, for me, professional relationships are really important right now from a young professional standpoint, because I'm less than a year into my job, and, I'm always looking for ways to learn new things and grow in my field. And one of the ways that I really like to meet new people is through camps and conferences. I love a good conference because I'm always trying to learn, and to be able to meet people who are not only at the same level as me, that can be supportive and that, we can journey together with. You also get a chance to meet people who are, ahead of you in their field and, really get to learn from them. And for someone like me, who's actually very shy, conferences are a great way to meet new people because they're super structured in that kind of format. So it's really easy to meet people that way.
Great. Thank you. Thank you all. So now I'm going to feed some questions to you that we're starting to receive from our worldwide audience today. The first question that I want to ask you all, the field of public health is very, very diverse. Even our panel today, some of you are dealing with health communication, others in health education. We have one person that's dealing or has a background in health policy. How did you make a decision about what area of public health you wanted to go into? Of course, there are places like epidemiology, biostats, dealing with social and behavioral issues. There's a lot of different routes that you can go into. So how did you make a decision to say, hey, this is what I want to do in the public health world?
I think that I came to the conclusion that I was going to do health policy while I was working or volunteering at a health department. So I worked in community health section of the health department, and we primarily worked in smoking cessation. And it was really cool, and I really liked community health. But I also got to float around to different areas of the health department. And something I noticed was that all of the things that the people I was talking to referred to were decisions made at the state level of the health department. And then it went even higher than that. And I really was interested in the policies that were developed and how they trickled down to the people on the ground in public health. And that's really how I decided to concentrate in health policy. Now, while I was in grad school, I discovered that I really like statistics, and I was good at it. And I had the choice between sticking with health policy and going into statistics, but ultimately, I liked health policy more. And I realized that you can really do anything. I'm not quite in health policy right now. I've sort of veered off again after community health and then health policy. So even if you pick a specific area, you're not going to be stuck with that for the rest of your career. There's a lot of room to maneuver and to take the skills in that specific concentration into a whole different field in public health.
So I have another question from our audience today, and I'm sure myself and as well as our panelist guests, we've kind of gone through this. Public health is a very special discipline, and we've seen the rise of many different programs around the country. So for someone who's trying to make a decision concerning their advancement in their education, what type of processes did you go through in selecting the best program fit for you, meaning the best school for you to choose from?
I mean, I can give a little bit of context for what made me choose the University of Maryland over other schools. So I think that I was looking for a school that would keep me in the DC area, especially because so many public health jobs kind of are located here because, it's the capital. And so many organizations have their headquarters here, including APHA. And so it ended up really kind of coming down between George Washington and UMD for me. And I saw at UMD a much larger opportunity to get involved, especially with research. I actually ended up not really getting too involved with research in the end, but I can't stress enough that there are so many opportunities for research and even just other graduate assistantships in the field that not only get you experience, but get your education paid for. And UMD is super, super unique in that way. So that was a huge deciding factor for me. But I also looked specifically at different programs, right? So when you're looking for a public health school, you want to look, at what school overall is good, but you also want to look at what school is better for the program that you want to go into. Because if you want to study something like maternal and child health, well, maybe UMD is not the best fit for that, or maybe another school is not the best fit for that. Maybe they don't even have that program, So I think really doing the research on what you're interested in is going to be a major game changer in your school search.
Okay. Well, I have plenty of more questions from the audience. So I just received a question now. The individual wants to know a little bit about, what are some of the ways or techniques that you should look for when it comes to certain types of public health jobs? Are there certain databases that you look for? Is there a certain way that you type into a query into a searchable database? Or do I just go to Google and type something in? What is the method behind, trying to find those positions that are the best fit for you in your career?
So I can tackle that one. For me, I think it was super effective to use all platforms. I've used Google Jobs. I've used LinkedIn. LinkedIn is my favorite in terms of just being able to see who in your area is in public health, who you're connected to in public health, and which organizations have hired people that went to the college you went to. So I think that in terms of just my background and experiences, using the LinkedIn job tool application has been really effective. And it also can show you who works at that organization now. So you get to see all those things at one time while submitting a job application versus just sending a resume and a cover letter to a dark web of information that you may never see again. So I think that using LinkedIn for jobs is super, super effective. That's like number one on my list. If you could apply anywhere, definitely use LinkedIn.
Great. Yeah, definitely some helpful tips.
Yeah, and I think it's important to add that your school might have a LinkedIn type tool, because UMD has an alumni network that's really just like LinkedIn for UMD students and alumni to job search and to connect that way. But also for public health specifically, look at different public health organizations. APHA has a job search network. I know NACHO has a job search network. I believe you have to be a member to access these job search networks, but APHA definitely has student rates for membership that are pretty affordable. And you can also talk to your school about becoming a member that way. And so it kind of helps to funnel down on a lot of the noise that you get when you're looking for, these jobs that can at times be very niche.
Yeah. So I would also say that I would be more leery of using Indeed and Monster and websites like that, because from personal experience, I've had issues with like random recruiters contacting me and getting spam recommendations. So you have to be a little more careful about the huge job board websites. I would try to get more specific if you can. And there's definitely a lot of resources out there. There are even public health Facebook groups that you can join, and where people will post jobs that either they're hiring for or they know someone who's hiring. That's another good way to find jobs.
Well, we all know that the choices that we have in life are hopefully ever endless. And, all of you have ended up in the public health field, but, what do you plan to do to further your career? I know a lot of people out there have multiple passions in life. Have you ever considered, going and getting another degree, or while you were in school, did you ever consider doing like a dual degree program so you can tap into multiple disciplines to, reach your highest potential?
Yeah, as someone who, as mentioned, wanted to be a doctor originally, this is definitely something that constantly weighs heavy on my mind, to be completely honest. I think that going to med school or even getting a PhD is something that is definitely still in my future. And it's something that I do consider. But as a 25-year-old who just graduated less than a year ago, I try not to stress myself out with making those decisions. I know that I have the time to do and be whatever I want in my lifetime. And so, I want to encourage everyone to really know the multiple things that they want to do, and, the additional degrees that they may want to take, and know that, you can do it all back to back, or you can take the time to spread it out. It really is not something that has to be done all at once. I think we have kind of a culture of trying to get to the highest point that we can the fastest. But, it's also really important to take time to really think to yourself about how you want to traverse those additional careers.
Yeah.
Yeah, I would say that I was pre-nursing before this, and I sort of jumped into public health and I haven't looked back. But that being said, I have considered getting certifications that would help me in my career. I've considered getting a PMP, which is like a project management certification, the CPH. There's a certification in healthcare quality, which I'm interested in. So there are other ways other than getting another degree to possibly get you where you would like to go. And like Ayana said, like, you don't have to rush to do everything right now. You're going to figure it out as you go, and you don't have to say, oh, I need to go back to school right away, or I need to do this or that. Like, it's all going to come in time. You just have to be a little bit patient.
Yeah. Great.
Yeah, I think, sorry.
Go ahead.
I think that, again, from the perspective of someone who did decide to take that gap between undergrad and another degree, it's kind of given me a lot of space to think about other passions. And I think one of those passions is entrepreneurship. So I think that in terms of certifications, like Aaron said, going to get a certification in wellness coaching is something I'm definitely planning to do in the near future. So I definitely agree with the sentiment of like not rushing your process and really just being patient with yourself in terms of your next step.
Great. Thank you very much. So, interestingly enough, I'm in the presence of 3 women of color here today. And a question that I have for the panel is, how do you navigate the public health field as a Black woman? And what advice would you give for not only Black women who are out there, but other minorities out here in the field, or for anyone who wants to work in a diverse community of people and employees? Talk about your experience and what advice would you give to people out there?
So I think I like this question a lot. I think it's important to connect with people who look like you, even if it's not in person. Like, I'm on a Facebook group called Black Ladies in Public Health, and just hearing about other people's experiences, a lot of them are like, I'm the only person who looks like me in the room. And I sort of grew up that way. So as part of my background, I grew up in a predominantly white area. I went to schools where most people were not Black. And so I'm sort of used to being that person who stands out, for better or for worse. But it's really good to always connect with people who are experiencing the same things as you and can give you insight, and have your back. A lot of people will come to the Facebook group and ask, like, I had this interaction with a coworker and I was really uncomfortable. Can you help me to understand, or to how do I address this, and how do I bring this to the attention of people who might not be thinking about my perspective or the perspective of people who look like me? And I just think getting those different insights and that feedback from people who have had the same experience as you is really important.
Yeah. Anyone else?
I agree. I think that's super important. When I worked for the National Park Service, my boss and I were the only 2 Black people in that office. And so I think that experience was kind of different, going from someone who's from Prince George's County, where it's mostly Black, and then going to HBCU, where it was mostly Black, and then having that experience kind of really made me tap into how important it is to have people who look like you around. So like Aaron said, even if it's not necessarily we're meeting up every week, having a virtual family of people who understand your experiences can really help, generally, and just on a mental health level. Just being able to discuss different issues with people who understand where you're coming from, I think, is super important.
Yeah, and I think it's important to add that I think for myself, I am fortunate enough to work on a really diverse team at Hopkins, and actually many of my bosses are women of color, and so we're all kind of privy to issues that really affect us in public health, but we still do use our identities kind of to serve as advocates, right? So I think a great example of this is, when we are hosting panels or something like that, it's so easy to get, 3 white guys on a panel. But especially at Hopkins, there's no need to do that when there are so many other people from diverse backgrounds that could also serve on that panel. And we know that their voices will help us reach, a wider audience than a more homogenous looking panel. And so in that way, little things like that, I try to use my identity to be kind of an advocate. But I'm also super fortunate to work in a position where I have a lot of creative freedom. So I use my position when appropriate to tell stories that I know are really important to diverse backgrounds. For example, we have a diversity symposium every year that is done by our postdoctoral students. And for me, I was really excited to cover it because I spend a lot of time in lectures and receptions and just running around labs. And I'm almost always the only Black person in the room, and I'm not even a scientist. So I knew at the time that, I wanted to paint this symposium as, something that is what the world is supposed to look like. This is what medicine is supposed to look like. And I think that not only, I ended up doing a photo series, which is kind of a unique way to capture an event. But I think that was not only helpful for our audience, but it was really helpful for me because it really felt so good to do what I do medicine in a environment that was so diverse for once. And so I really love the fact that I'm able to kind of tell those stories as a Black woman in this field.
So what advice would you have for someone who has a desire to use public health as a avenue to help communities of disparity, to deal with communities or individuals that deal with socioeconomic despair, inequality issues, whether it be something related to race and ethnicity, gender inequality, sexual orientation inequalities that exist? How can they use a field of public health to kind of tap into those specialized areas? I think, Christian, you're still on mute.
Sorry, that keeps happening. I think from the perspective of someone that is in the health education world, it's just been super important for me to approach everything with an open mind and really listen to people's stories. That has been the most transformative thing for me as a health educator. And I think that oftentimes it can be very discouraging when you look at the numbers and you see, the rampant numbers of people who are affected by one specific disease and how that compares to the majority. But I think that overall, just being an open mind and giving people space to tell their stories has been super helpful for me as a health educator. The medical system and all the other systems that work in contingency with each other to kind of keep people oppressed has been very discouraging for me. People not having access to things they should have access to for free has been very discouraging for me. But again, just as a health educator and giving people space to share with me the things that are bothering them on a health level has been super helpful.
I just received a follow-up question from the audience, going back to our previous question about advancing your careers. I know some of you started to discuss potentially pursuing some certifications. I know, one of the more difficult areas to break into sometimes, especially coming from an undergrad perspective, you don't get a lot of research experience. So if you wanted to pursue a career like a research analyst, are there any certifications that you could recommend for someone to pursue, to strengthen their research analytical skills?
I can definitely talk about this a little bit because UMD is so research focused. And so I don't know that there are any certifications that you can get outside of maybe becoming familiar with different software like SPSS and SAS and more statistical analysis software. But I think that for research, it's really important to just get the experience and to try and get the experience from and as early on in your education as you possibly can. That's something that I really struggled with for a long time. Research was some myth that everybody around me was doing, and I couldn't figure out how to get into it myself. But I think that, I over time learned that a lot of students were reaching out to faculty themselves, asking if they had, a place in their lab. And again, looking for when you're looking at different programs for school, looking for schools where those research experiences really are in abundance. I think at UMD, it's almost expected of you to do research at some point in your graduate education, not even related to your master's capstone or thesis. So I think that, learning the software and then really just keeping your ear to the ground, reaching out to people and asking them how you can get in their lab, is a huge help in that.
Well, we're nearing the end of our question and answer period. So I'm going to ask you all one more question. And this is more futuristic futuristic in thinking. But, when it comes to looking at the next generation of public health workers, what do you think, are some of the main challenges that they're facing? And what's one piece of advice that you would give to our future public health workers as they are planning to be in the same place that you are 2, 3, 4 years, 5 years down the road? What would you tell them? And you could even relate it to what we're dealing with here in COVID-19. I think about the public health world and the need and the challenges that we're facing in terms of social distancing and being able to use technology to communicate with everyone. But I think, Erin, did you have something that you wanted to say?
Yeah, I have a thought. So I think something I wish I had known more about, or that I had known was coming when I was in grad school, was about health information technology. There were like whispers of it in grad school, and like we had a course came on as I was leaving grad school. And I really wish I had read up more on it, because that is where everything is going next. When you go into the doctor's office, and now when I do intake, you fill it out on an iPad, and then how that relates to the electronic health record and how everything is moving away from paper. I think, and even like as far as like collecting data for public health and how we can pull it directly from EHRs, that's where everything's moving. I wish that I had done more research on that to understand that before I got into the public health field, because that's a huge part of my job now. And it's a lot of the public health space talks about health information technology and protecting individuals' protected health information. So that's something that I would definitely encourage people to look into, because it's going to be a conversation that people are probably going to be talking about even more after COVID, because if our healthcare systems can't communicate, how are we ever going to get accurate numbers of who has COVID? Like, what resources do we have in this environment? So that's a big piece of research that I would recommend people look into.
Yeah, so I think that, for the future of public health, it'll be really important, I think, like you both said, to look at the ways that we are addressing coronavirus in this country and really applying that to future, endeavors and future projects. I think that we are, of course, as public health students, very aware of the shortfalls of the healthcare system in this country. But in a lot of ways, coronavirus has really blown that wide open. And so, while we may be prepared with our knowledge of those shortfalls, it's definitely going to be a challenge with the changing dynamic that is happening around those shortfalls and, the changing conversations that we're having. And so I think for some force, immediately and in the next few years, that's going to be something that is really going to take some adjusting to. And so I think that really paying attention to that would be a great way to kind of better prepare yourself for that. I also think that, increasingly we are living in an age of, scientific mistrust. And we know that, science is what backs everything that we do. And we saw that a lot with climate change. It's the reason why we even have the term climate change and not global warming. But we are seeing it even more with coronavirus. And, the more this continues, the more we're seeing just completely incorrect information being thrown in our faces. And so I think that that's also going to be something that's really important to pay attention to in the future, because now we are not only having to ask ourselves, how do we get information to the public in a way that they can use it? We're having to ask ourselves, how do we get information to the public in a way that they believe it? And so I think that those are two really big issues that the coming workforce is going to need to pay attention to. I think that someone asked about my website. So my website is just ayanatucker.com. So you can go to my Twitter. It's also linked there, which is Ayana J. Tucker. And then if you ever want to learn more about communications, you can email me through my website or like just DM me on Twitter.
And was there anything you wanted to add, Christian?
I think they covered all the bases. If I could add anything, it'd be to take advantage of research opportunities at your university. If you could learn about disease surveillance and epidemiology, even on a small scale, I think it helps a lot. I have a lot of friends who are really, really busy right now because of COVID. But again, just taking advantage of opportunities that exist in your area at your university in terms of research and disease surveillance can be really helpful.
Great. Thank you very much. Well, I want to say thank you again for all of our panelists for joining us today. Aaron, Ayana, Christian, you've been great. I'm going to turn the microphone back over to Vanessa, who's going to share some closing remarks with you all. But I'm great that I could spend this time with you. We had a great discussion, and hopefully everyone out there has learned a lot today.
Hello, everyone. So, as Christopher said, I do want to thank Christopher, Christian, Aaron, and Ayana for speaking today. And I want to thank all the viewers for watching today and interacting with our panelists. I hope that the knowledge that they shared will help you as you continue to navigate the public health field. And if you have any questions or want to ask any of our panelists a question that didn't get answered today, you can send it to me at vanessa.egbe@apha.org. And then we can kind of, work through how to contact them and how to get your specific questions answered. But yeah, just thank you all. Stay safe and stay healthy.